People might not understand climate change, but they do understand that a lot of people are dealing with health issues. Some of those African-American churches are right smack dab in the African-American communities, but they're right there in the hazard areas. And so even when I talked about having a community garden, they have to test the ground to make sure there's not lead, to make sure it's not any kind of other issues.
Well, the majority of health disparities and lack of health equity is primarily in African-American and other communities of color. And one of the ways that we can reduce these disparities is to increase the workforce. Minority young people, and we have a lot of continuing students that will impact the field because they have lived experiences. And so having folks coming out of a public health program into the community is really a strong way to advance health equity.
Main takeaway is I want everybody to be an advocate for maternal and child health as they're being an advocate for disaster preparedness and environmental justice, because there's some great disconnects between the two fields. But we see that Black and brown mothers, families, and those that are pregnant and nursing are most vulnerable to some of the impacts of these disasters that we've been seeing recently. I think even for myself, as someone born and raised in Louisiana, I was kind of keeping the two issues separate. But it's from really the work that I was doing in breastfeeding and seeing that there were families that were feeding their baby formula that weren't able to get to formula after disaster, and kind of seeing firsthand.
I'm telling you, one of the bills I'm pushing for this coming session is making North Carolina a green state. And this is perfect for what I have plans for this year coming up. I've been working with Pricey Harrison on making North Carolina a green amendment state. And what that consists of is making sure we have clean air, clean water, making sure everybody's been educated on. And I cannot thank Black Alliance enough for their work and all the organizations that are here to support this initiative.
Think about grounded in justice and the idea of what that means historically for our communities. We've always fought for justice, right? But rooted in the idea of what wellness means, and not only just mental health, but mental wellness. Combining those two with the idea of our community is always going to be, unfortunately, continue to be subjected to environmental concerns, health concerns. And with the recent natural disasters we're seeing, not only just the fires in California, but at home here with Helene recently, it was important for us to have conversations around what agency and resiliency, specifically to our communities, means, because that conversation I haven't heard it. And that's a conversation I felt like it was important for us at our summit to really begin, to be able to allow people who come to take that home, have conversations with their communities, their families, on what they can do to help better their community.
My vision for the summit was to create a space where folks understand how environmental justice is an issue that is also connected to healthcare. The wording grounded in justice comes from, we want our communities to experience justice. Right now, with the hog farms, PFAS, contaminated air, they're not experiencing justice. That's why we call it environmental injustice. We also know that it's affecting their health, and rooted in wellness allows us to extend just beyond like our physical health, right? But our mental health, our spiritual health, all of the different elements of wellness, they all come into this space as well. And when we are experiencing environmental injustice in our communities, it's disrupting all of those different dimensions of wellness too.